Hello to all of you. Today we will give you information about the placenta. Let's start placenta previa, which is defined as the placenta, that is the baby's mate blocking the cervix and birth canal, is a condition that can put the life of the mother and the baby at risk and carries different risks in itself. While it is important for pregnant women to have regular ultrasound follow-ups for early diagnosis, the experience of the physician and appropriate intervention planning play a major role in solving this problem. What is placenta previa? Placenta previa is defined as the placenta, the baby's mate, blocking the cervix and birth canal. This makes normal vaginal delivery impossible and is associated with a very serious risk of bleeding. Placenta previa occurs in approximately 4 out of 1,000 births. Above 20 weeks of gestation, placenta previa should be suspected in all pregnant women presenting with vaginal bleeding, and necessary evaluations should be performed. In these patients, vaginal examination should never be performed without determining the location of the placenta by ultrasonographic evaluation. This condition is known as the baby's mate being below among the society. What are the symptoms of placenta previa? The main symptom of placenta previa is painless bleeding from the vagina in the second half of pregnancy. If bleeding occurs in the second or third month of pregnancy, you should consult a doctor. Bleeding can sometimes be quite severe. Some pregnant women may have uterine contractions with bleeding. Only 10% of patients do not have vaginal bleeding until term, end of pregnancy. Sexual intercourse is not recommended during the course of pregnancy, as it may cause vaginal bleeding. Similarly, heavy lifting, intense exercise, and prolonged standing work are also not recommended. What causes placenta previa? Risk factors are more important than the causes of placenta previa. These risk factors can be listed as follows. Placenta previa in the previous pregnancy is a risk factor. Placenta previa recurs in 4–8% of subsequent pregnancies. The risk of placenta previa is higher in those who had a cesarean section before. Having a cesarean section increases the risk of placenta previa by 47–60%. As the number of cesarean sections increases, the risk of placenta previa increases even more. Multiple pregnancy is also a risk factor for placenta previa. In twin pregnancies, the risk of placenta previa increases by approximately 40% compared to singleton pregnancies. The more pregnancies there are, the higher the risk of placenta previa. The advanced age of the mother is also among the risks. A previous miscarriage or abortion is also a risk factor for placenta previa. Smoking is also a risk factor. How is placenta previa diagnosed? Placenta previa is diagnosed by ultrasound. After listening to the anamnesis of the pregnant woman, the diagnosis of placenta previa is made by confirming that the placenta is blocking the birth path, internal cervical os, on ultrasound. In patients diagnosed with placenta previa, the risk of placenta accreta also increases. Placenta accreta describes the abnormal adhesion of the baby's mate to the uterus. Tighter and deeper adhesion increases the risk of bleeding. Sometimes abdominal ultrasound is not diagnostic. In such cases, transvaginal ultrasound is also performed. It is detected during routine examinations or when investigating vaginal bleeding. If the diagnosis is early, danger is prevented. How is placenta previa treated? In pregnant women diagnosed with placenta previa, the mode of delivery should be cesarean section. Vaginal examination should never be performed. Before 37 weeks, the risk of premature birth increases approximately 5 times. In 15% of pregnant women diagnosed with placenta previa, labor occurs before the 34th week. Since there is a risk of serious bleeding in pregnant women diagnosed with placenta previa, the possibility of receiving blood transfusion also increases. In cases before 34 weeks of gestation, steroid injections should be given to contribute to the development of the baby's lungs. The risk to the life of the mother and baby is increased in this problem. For this reason, a cesarean section must be performed in a hospital with a blood bank. The blood bank should be informed before the cesarean section, and it should be stated that additional requests can be made during the operation according to the need. It is vital that the delivery takes place in centers with the capacity to intervene surgically and medically. What is the placenta? The placenta is not a permanent organ. It is temporary. It helps the exchange of nutrients between mother and baby during pregnancy. It secretes hormones that play a role in the growth of the baby and provides nutrient exchange between mother and baby. The placenta transfers glucose, amino acids, fatty acids, calcium, vitamin D, oxygen, and immunoglobulin G, IgG. which is responsible for immunity from the mother to the baby and transfers carbon dioxide and other waste materials from the baby to the mother. The placenta prevents an infection in the mother's blood from spreading to the baby. If the placenta does not develop, growth and development retardation occurs in babies. The placenta plays the main role in a healthy pregnancy. What does the placenta look like? It has a flat or round shape. Its diameter varies between 15 and 20 centimeters. It has a reddish color, and as the birth approaches, it may have white parts because it contains calcium stores. It weighs an average of 500 grams. It is connected to the fetus by a 55 to 60 centimeters long cord. When is the placenta formed? The placenta begins to form at the beginning of pregnancy and develops in the first 12 weeks of pregnancy. What does it mean for the baby's mate to be down? The condition of the baby's mate being below, that is, the placenta being below, is placenta previa. In a more understandable way, it can also be called that the placenta closes the cervix, or part of it. When does the mate of the baby go up? It is usually possible for the placenta to shift by the 20th week of pregnancy. In the early stages of pregnancy, the placenta can be located close to the cervix. As the uterus grows, the placenta moves to the upper parts. For this, it is waited until the 24th week of pregnancy. What should those with a lower mate do? They should not neglect their medical checkups and should contact the doctor even in case of the slightest problem. What should people with placenta previa pay attention to? Those who have placenta previa should talk to their doctor frequently. They should have regular follow-ups. It is necessary to get used to the idea of cesarean section, because this problem prevents normal birth. If the doctor has prescribed bed rest, this must be strictly adhered to. In addition, it is important to remember that many pregnant women with placenta previa have healthy births and not to be demoralized. Since uterine contractions will initiate premature labor and therefore bleeding, labor suppressant, tocolytic treatment is started in pregnant women with labor pains. In this way, the expectant mother, who is monitored in the hospital until her condition stabilizes, can be discharged from the hospital on condition that physical activities are restricted at home if the baby's maturation is not yet complete. During this period, follow-up visits should be regular. Sexual intercourse is prohibited during this period due to the risk of bleeding. If the baby's maturation is not yet complete, it can be discharged on condition that bed rest is continued at home. In the meantime, follow-ups are continued as often as the doctor deems appropriate. Sexual intercourse is also prohibited in patients with placenta previa because it may initiate bleeding. During follow-up, when the baby's maturation is complete or vaginal, bleeding reaches serious levels, a decision is made to deliver the baby. In placenta previa, delivery is by cesarean section. What are the types of placenta previa? Placenta previa can be listed as marginalis, totalis, partialis, and downplaced placenta. What is placenta previa marginalis? In this case, the placenta is located close to the cervix. Its edge touches the part of the cervix, but the cervix is not completely closed. What is placenta previa totalis? It is the name given to the condition in which the placenta completely closes the cervix. What is placenta previa partialis? The placenta is also down here, but the cervix is not completely closed. The cervix is partially closed. What is a low placenta? The placenta is positioned lower than expected. The birth canal is not closed. It may be possible to have a normal birth here. However, this is decided by the doctor. What is abruption of the placenta or placental abruption? It is a condition in which the placenta separates prematurely. A dark, non-coagulable hemorrhage occurs with pain. It is a serious condition that threatens the life of the baby and the mother. When should a cesarean section be performed in placenta previa? ACOG, American College of Obstetrics and Gynecology, recommends a planned cesarean section between 36 weeks and 37 weeks and 6 days. It should be known that premature labor will occur in placenta previa. What should be considered in cesarean section in case of placenta previa? Placenta previa is a problem with a risk of bleeding that can endanger the life of mother and baby. Therefore, preparations for appropriate blood products must be made before the cesarean section. The blood bank must be informed. It must be ensured that appropriate blood products are available in the blood bank. Cesarean section of pregnant women diagnosed with placenta previa must be performed in hospitals with a blood bank. The blood bank should be informed before cesarean section, and it should be stated that additional requests can be made during the operation according to the need. It is vital to plan the delivery in centers that have the capacity to intervene surgically and medically. The experience of the physician who will perform the placenta previa operation is very important. What are the risks of placenta previa? The biggest risk of the problem is hemorrhage. Along with the risk of bleeding, there is also a risk of premature birth. The birth takes place urgently by cesarean section. In the meantime, bleeding may occur when labor starts. There may also be risks because the placenta blocks the birth canal. The placenta can sometimes adhere to the uterine wall. In some cases, it may be necessary to remove the uterus to save the mother's life. Does placenta previa cause pain? Expectant mothers with placenta previa usually do not experience pain. However, in rare cases, expectant mothers may feel pain in the lower abdomen. There may be mild pain after sexual intercourse. Apart from these, it can be said that a regular and continuous pain problem does not occur in placenta previa. Is there a placenta previa totalis surgery? There is no surgery to eliminate the problem of placenta previa. In other words, there is no surgery as the names of the placenta previa types are mentioned. Expectant mothers are generally curious about the treatment process after the diagnosis is made. The treatment plan is explained by the doctor on a patient-specific basis. Can a woman with placenta previa give birth normally? Normal birth is not possible in pregnant women with placenta previa totalis. Normal birth is possible in pregnant women with partial or marginal previa, but it is still very risky. For this reason, it is safer to have a cesarean section to prevent possible complications. Is there a risk for the baby with placenta previa? Anemia may also occur in the baby due to bleeding caused by this problem. Babies may have position problems due to placenta previa. The baby, who should be upside down, may be in the womb with the buttocks down. If it causes premature birth, prematurity problems may occur in the baby. How should people with placenta previa sleep? If the person is diagnosed with placenta previa, sexual intercourse and vaginal examination will be prohibited. The physician may recommend complete bed rest or prohibit exercise and excessive fatigue. What is done in placenta previa if there is blood incompatibility? Again, a very important point is that if you have blood incompatibility, it should not be forgotten to give the incompatibility injection. As in every bleeding during pregnancy, thank you for watching.